Hello. A very good morning, everyone, and thank you for joining us today for our webinar. My name is Zhihan, a research assistant at SSR, and we are very pleased to have the Mission Tilam team from AMK FSC Community Services share about their project and resource tools for practitioners. We are also thankful to have Dr. Caris Chan, Research Fellow from the Center for Work, Organization and Wellbeing at Griffith University, moderate the webinar from Australia, which I believe is lunchtime now. Before I hand my time over to the speakers, I will first make a few announcements. We are streaming this webinar on Zoom and recording this session live on our SSR Facebook page. Once the webinar is over, we will upload a recording on Facebook. By participating in this Zoom webinar, you consent to this recording and for SSR to use it for publicity. You may post and vote for your questions via our Pigeonhole link, which I will send in the Zoom chat. Once the Q&A session is open to the floor later, you may also use the raise hand function if you wish to turn on your camera and unmute your microphone to speak directly. However, we will not be taking questions from the Zoom chat and the Facebook comments section. As we have a limited amount of time for Q&A, we apologize if we are unable to address all questions. With that, I will now hand over to Huzaifah and his team to begin the presentation. Thank you.
Yeah, thanks. Good morning, everyone. Thanks, Johan, for the introduction. I'll be sharing screen now to the PPT slides. Okay, good morning to everyone. Hi, I'm Huzaifah here, and today my team and I will be presenting insights from Mission Tilam. Mission Tilam is a program with AMK FSC that has been ongoing for the past 4+ years or so. Yeah, so we are squeezing 4+ years of insights into 40 minutes. So please bear with us as we bring you through good or things that are helpful from Mission Tilam. And before we go into the sharing, I think just a disclaimer first, when we're talking about sleep, we are social work practitioners, and therefore we are not practitioners that would analyze or interpret your dreams. No, unfortunately, we don't do that. We can't find out what is the next 4D number that will come out so that you can strike 4D or Toto. Yeah, and also we are not medical doctors. So we are not practitioners who are trained in sleep medicine. And therefore, what we actually focus on when we talk about sleep is the social environmental aspects of sleep and the meaning-making processes in terms of one's relationship with sleep. So how else do we talk about Ground Up Initiative other than ground experiences, right? So I'll bring you through a memorable home visit that took place in October 2016. Yeah, that was quite some time back when I was a junior worker when I started practicing social work. So we received a referral from a 70-year-old grandmother stating that her daughter has been incarcerated. Her daughter is a single parent, and therefore she is caring for her 7-year-old and 4-year-old grandsons. And the visit that we made to Madam A is intentional to collect information and to see how we can support her in some of her caregiving and employment and financial assistance as well. So it's a one-room rental flat. The picture here you see is kind of the floor plan of what transpired when we entered the door. So when I knocked the door with my fellow home visit partner, she was sitting right on a wooden stool facing the television. It's a one-room rental flat, so the distance between the door and the TV is actually quite close. Yeah, if you are not familiar, a one-room rental flat is just a box about 30 meters square or so, and it is also inclusive of the kitchen space and the toilet as well. So grandma was sitting on the stool looking and watching television. It was a really hot day. So Grandma, the cooling device was actually a fan, and there's another fan closer to the television where the two children were sitting and playing. Yeah, a 7-year-old and a 5-year-old grandson. So when we come in, we took off our shoes, we entered the house, we greeted Madam A. Madam A invited us to sit on her sofa. Her sofa looks somewhat like this, but it was black in color and it was quite a mini sofa, just nice to sit me and my home visit partner. Yeah, we were talking more about what's going on, and the house is actually very clean. Yeah, you can tell that the floors are clean and there's little clutter. But what I noticed was that the cupboards were all metal furnitures. Yeah, so metal furnitures, it was actually similar to the lockers you find in schools where the cleaners would keep their brooms and their dustpans. Yeah, it was those kinds of furniture, and the furniture was also used to segregate the space between like the living area and behind where they would kind of rest or sleep or do their prayers. So I was attending to Madam A, understanding how she's coping with her incarceration of the daughter, and also understanding a bit more about the kids' needs. So they needed to enroll into childcare, and for the elder one who is in primary 1, for him to be enrolled into student care. So as we were talking about what are the steps that we need, what are the documents that the FSC requires to support in this request, suddenly the children were playing on the playmat, and we got to know that they were playing on the playmat because their mattress that they were sleeping on was actually soiled because the elder one bed wets at night, and therefore the mattress is being hung outside the house, and they don't even have space outside the house. They have to hang it a bit further down because in a one-room rental flat structure is that the houses are adjacent to each other, so they have to walk a bit closer to the staircase to actually hang the mattress there. Yeah. So when we're talking to Grandma, attending to Grandma, understanding how Grandma also had to leave her job in order to care for the grandchildren, we heard certain thumps-like sounds from the two boys. They were playing with their mobile phones and like kind of teasing each other and jumping around. And we kind of heard more thumbs as they were trying to stamp their heels and foot on the ground. Yeah. But what was interesting is that because the distance was quite close between where I was sitting and where they were playing, we started to whiff a smell. So it was a sweet, musky smell. And it is a smell that is quite familiar to me because I have had some experience before when I was in my national service days. And when I turned around and I looked at the two kids, what we saw was streaks of blood on the floor, like blood stains like just on the floor. And when I saw that, and Grandma saw that, Grandma panicked a bit, and Grandma said, come back already lah, this thing. Yeah. And true enough, what we got to witness there and then was that the children were playing a game in terms of stepping and killing bed bugs, or the bed bugs that was there right in front of them when they were in front of the television. There wasn't any shock or surprise. It was more like a game for them, and they were enjoying and stepping and they were enjoying. But I guess for me and my home visit partner, we were quite alarmed. Yeah, we feel like oh no, there's bed bugs issues in the house, and we asked Grandma more about it. And Grandma mentioned that it's precisely because of the bed bugs they had to throw away a lot of their furniture. They don't even have a proper bed or mattress at home because they had cleared them out the week before. And because they couldn't afford fumigation services, they took matters into their own hands, and they used homemade remedies such as kerosene oil, insecticide, pesticide, just to try to get rid of the bed bugs. And as I was talking to Grandma and us sitting on the couch, Grandma actually said that, oh, we threw all the furnitures except the couch that you are sitting on. Oh, because this one got sentimental value and is something that was passed down to me by my mother. And I think when that was being shared, it really also shocked me. Yeah, I was wearing my favorite pair of jeans and I'm sitting on a couch that could potentially have bed bugs. A lot of my emotions back then was a mix of fear, shocked and also thinking about what's going to happen, I quickly stood up from the couch when I get to know more, and I started inspecting the home. And true enough, behind the cabinet, there isn't any mattress bed, but instead they were sleeping on straw mats. And these are the only things that are left after they voluntarily cleared to try to get rid of the bed bugs. Yeah. So I was taking a walk and asking permission to look around a bit more about the house. And grandma says that the bed bugs would usually come from the cracks in the walls. So as much as they try to clean the house, to make the house free from bed bugs, it's a recurrent thing that has been going on for an extended period of time. Yeah. And what was interesting after was that when we spoke to grandma to understand a bit more, grandma said that the children would tend to usually have bites, quite a lot of bites, but it heals usually the day after. So it's something that causes discomfort and death, but it doesn't cause them to the point where they have to seek medical treatment. And I think this is also an area that we have identified we want to assist them with. So we quickly got our information, we tried to get a bit more, and suddenly grandma's eyes started darting around the room. Yeah, she started looking, she saw that we were afraid, and for some reason she stood up off her chair, and then she walked closer to the fan. The fan that was blowing towards the children, the wind. The fan is quite an old fan, and it looks something like this stand fan that you see here. What she did was that she almost like had predatory eyes, like as if she's like grabbing the fan by the neck. And then she took the fan up and then she started shaking the fan. And true enough, like some stuff dropped out of the fan. And grandma exclaimed, yeah, see, oh, this is where the things are hiding. This is where bed bug hide. Yeah, and you see like three, four creatures like with their hands up and down and just like there on the floor. And grandma suddenly started going into psychoeducation mode, telling social workers, oh, you see, you don't kill them, you know. And she took out a lighter from her pocket and then started to burn the bed bugs one by one, and informed us that if you burn the bed bugs, then the smell won't be strong. It's just like carbon smell instead of the very strong pungent smell that you have when you kind of squish it or you try to squeeze the bed bugs. Yeah, so it was really quite a shocking experience. I think I was also quite taken aback, and I'm not sure what to do with this new information that I'm doing. So we saw the demonstration, we learned a bit more and understand a bit more from grandma's perspective. And then after we go back home, and back home when I explained the situation to my family, I actually got scolded because they say, you know, the house got big bugs, who asked you go inside the house and sit at their place? And I think at the end of the day, when I was resting, a lot of reflection came, and it was also understanding a bit more about this experience that we have, or rather I and my home visit partner have been through. So as we thought and reflect a bit more about it, a lot of it comes to the point in terms of our relationship with our beneficiaries, whether clients or members of the communities. Were we being disrespectful by kind of being grossed out, or being like very wary, or suddenly a change in our disposition and our non-verbals when we get to know about bed bugs? And I think what's important is also, as I was sleeping, or I was about to sleep that night, I had some trouble sleeping because I was only there for 15 minutes, whereas this or that environment is where the families are living and that is their home. Yeah. How do we then reconcile some of these differences in terms of how we rest and how our beneficiaries, clients, or members of the communities rest? I brought this topic back to my supervision, and at the time, Anne was my supervisor. And I think one of the things that we discussed more about was really about the class difference. Yeah, about checking our own privileges and how we have been conditioned or socialized to see things as what is acceptable and what is not, or rather our tolerance in terms of living with bed bugs or such pests are not normal, or is different from how clients or beneficiaries view the situation. A lot more reflections were done, and I think that was also the start in terms of how we started our family interventions. Bedbugs was just one of the many different things that we see. But what is most important is that we started to talk a bit more about what happens after work hours. Yeah, a lot of the time, social workers, we visit our families in the daytime. We don't have the full family members at home in understanding what is the social activities like at the nighttime or towards the end of the day. And this prompts a lot more conversations and ideas in terms of how we can work differently with families. As you can see here, from just addressing remedial pest infestations, we looked into also doing a varied family sessions to address different issues. But what's important is that we take, okay, don't worry, we will send the slides at the end of the presentation. We look at sleep as an entry point to unpack meaning making. And we posit that sleep is a basic physiological need right there beside water, food, and shelter. Yeah, and a lot of the social work conversations or social workers conversations with beneficiaries and clients tend to also be focused more on work, like whether you got go to work, whether you got try to go for jobs, whether they got go to school, but rarely do we ask how do our families that we're working with rest. And this has something to do with how also ourselves, we define our worth sometimes tied to our how we are doing at work, our performance at work, and also our productivity, and how the interventions with families take a backseat to look at how they rest and do away with the preoccupation with work and productivity. Yeah. So as we tried to work with families for the first 2.5 years to understand a bit more, we realized that there's still a lot of understanding gaps or gaps in understanding when it comes to what we think of the families and what the families actually go through. And that was where our team embarked on practice research projects. And I will hand over the time to Chung Ying to kind of give an overview of what we did. And Chung Ying can go ahead.
Thank you, Huzaifah. Yeah, so I'll be sharing with you briefly about the two research that we have conducted over the past 2 years. The first research we conducted was a perception survey with the key community stakeholders that we work closely with for our cases, which we'll term as KCS in short for this presentation. It was a perception survey that aims to elicit a reflection of the comparison between the perception of KCS' own experience of sleep versus their perception of socioeconomically disadvantaged families' experience of sleep. For this presentation, we will also term socioeconomically disadvantaged families as SDF in short. Next slide, please. It was quite interesting because the perception survey highlighted the implicit assumptions and biases KCS has of SDF. First, they seem to be underlying notions relating to the different loci of control between their own self and SDF in managing the obstacles for sleep. For themselves, they indicated obstacles to sleep such as the change in lifestyle habits or the access to and use of technology, for example, watching shows, playing video games, suggesting that the obstacles are things that are more within their locus of control and more tied to their own SES status. For their perception on SDF, obstacles to sleep included things like changes in environment, relating to their physical home environment, such as the lack of space and overcrowding predicament in their rental flat, which seems to suggest that it is not within their control. Secondly, it was also noted that the narrative of work seems to differ as well. They narrated obstacles regarding work coming from their own high-intensive workload, whereas obstacles regarding work for SDF comes from their engagement in shift work and odd jobs. Next slide. Another interesting finding was that similar to the story of the group of blind men touching an elephant, where each man are only able to recognize the own specific part of the elephant that they are touching, only schools and FSC workers quoted specific challenges such as caregiving and parenting practices and a wider range of obstacles, whereas the elderly sector looked more at social support. This sector-specific remarks shows their priorities, in part considering their exposure to and interactions with their specific clientele group on a daily basis. Practitioners from specific settings are therefore more attuned to specific sets of obstacles and challenges that they are exposed to as compared to other stakeholders who might have gotten the information from elsewhere. Next, from the perception survey findings, we realized that KCS are framing the perception of high quality sleep in SDF to be a person and environment issue. Therefore, they view that bridging in access to needed resources for SDF to navigate or negotiate space to better fit with their environment is perceived to elevate the quality of sleep to mitigate the drastic effects SDF face. It also highlighted social and structural influences on sleep and the sleep of households, hinting that sleep could be examined from a systemic lens instead. So bridging back to our own practice, findings were then shared with community stakeholders to deepen existing collaboration working with families. So for example, working with schools, childcare, etc. We also hope to encourage reflexive practice in being more attuned to our own privileges and biases and how this might affect our work with beneficiaries. This inspired us to gain insights first-hand perspectives of SDF to triangulate the data. Hence, we complemented this perception survey finding with another research on the leave experience of SDF. Which brings us to our next research, where we tried to explore the leave experiences of SDF through their lenses via the photo voice method. You can read more about this research in the snippet issue, but in this presentation, we will just be focusing on two findings. One interesting finding that came out from the research was that caregivers exhibited signs of learned helplessness and resignatory gratitude towards their predicament. Next slide. The term resignatory gratitude is coined to capture how gratitude by the caregivers could be an expression of their learned helplessness. It revolves around the meaning-making aspects of caregivers. So for example, next, as you read the quotes from the families, even though objectively, as professionals, we know that the standards of their sleep environment is not ideal, but you can see how the caregivers are downplaying their struggle, minimizing their situation as they express helplessness or gratitude towards what they have and opted to do to make do with the situation. It was also noted that caregivers seem numb by the daily struggles about their sleep, that they have accepted this as part of their reality, and in some instances, even expressing gratitude for the little that they have, despite the challenges and difficulties they are experiencing. This could be due to the lack of agency and ability to overcome or change their predicament. Their helplessness could be misunderstood, as workers may see this as clients' resilience because they are okay or just grateful for it, but it might not be so accurate to capture the whole the living situation that they are in, because what they say could be due to their inability to change their environment instead. Next slide. Another finding that we wanted to highlight was also that family sleep routine was shaped by overlapping, number one, their family, cultural, and religious rituals. Number two, their work schedules and educational obligations, as well as number three, the health and illnesses of family members. As we explore what the routines of the families were and the reasons why their routines were as such, it was clear that their sleep routine was shaped around family, cultural, religious rituals, status of employment and non-employment obligations, and status of health or illnesses of family members. For example, a caregiver must wake up earlier and sleep later to take care of a loved one who is ill. Another example is when a parent comes home late from work and hopes to spend more time with their children to build the bond and their relationship. This will in turn affect the normative discourse that a child should always sleep earlier and have roughly 8 to 10 hours of sleep. Even though the part about spending more time with your child is well-intentioned and important for the family, this also shows that there's simply complementary or competing priorities for the use of space in the household that affects SDF's sleep routine, such that even as they try their hardest to increase their quality of sleep, they simply cannot. Next. As we conclude the two research, we notice that sleep is and has always been treated like an individual problem. You may have heard of people telling you to avoid drinking drinks that are high in caffeine after 4 p.m. Stop using your phones before you sleep to improve your sleep quality. This reflects how we see sleep as an individual issue. Hence, there's a need to shift in for a shift in focus from an individual problem to a public health opportunity in addressing issues surrounding sleep. Besides educating individuals and families we work with about sleep hygiene and suggesting to them personalized self-help strategies to improve their sleep, there should also be a greater emphasis in addressing the structural causes of sleep loss, such as addressing unfair and unhealthy workplace regulations, minimizing harmful hustle culture in workplaces and professions that glamorizes overworking and sleep deprivation, which Cindy will explore more later on. Next slide. Lastly, through the sharing of our research, we hope to have intentional conversations with KCS on sleep inequality in society. Sleep problems affect everyone, but some segments of the population are more affected than the others. The experience of sleep is differentiated based on one's socioeconomic status and housing type. And perhaps there should be better collaboration between community agencies and the public in co-creating solutions that are more realistic and suitable for disadvantaged individuals and families. Next, it is also very important for us as community practitioners to be reflective of our own biases and underlying assumptions when working with SDF and their issues surrounding sleep. Okay, I'll pass on the time to Cindy.
Yes, thank you, Chuni. Yeah. So as Chuni mentioned, there's also like the focus on the workers' well-being is so timely. Yeah, with the increasing awareness of social workers' well-being of psychological distress and risk of burnout, especially during the pandemic. Next slide. Yes, so Mission Tilam's Wellness Initiative is conducted after our research on sleep, as shared by Chun earlier on, and because of the increasing trends in awareness of social workers' well-being, we decided to talk more about sleep and rest with our own colleagues. So this Wellness Initiative actually provides a platform for people to focus on their own relationship with sleep, and staff from various levels such as frontlines, social work practitioners, SWPs, and HEAD come together to talk about it and suggesting ways to improve our rest and sleep in work-related contexts. Photo voice is also chosen as a medium to allow participants to capture the essence of one relationship with sleep using photos. Next. Wellness Initiative consists of 4 main components. Firstly, participants had to fill in a sleep log, which the questions was curated by the team. Secondly, 2 entries of their reflections alongside with images are submitted, which builds up to a photo collage at the face-to-face experiential segment. Then, a group chat was also created for all participants to support each other in this process, such as reminders to fill in sleep log. Finally, a face-to-face experiential segment with activities was conducted, providing a space to share their reflections and also having further discussions. There are also a pledge of commitment towards this initiative, $5 for staff and $1 for intern, and self-care items for staff usage were purchased with this pool of money. Next. Next, okay. Yeah, so here's a brief overview of the face-to-face experiential segment. It includes a self-reflections of their images that they have submitted, small group discussion to understand more about each other's sleep experiences, hearing a narration of clients' experiences with sleep, co-creation of art piece, and also a discussion on work-related stressors impacting sleep and ways to improve it. Next. Yeah, we will be showing a short compound videos of what the Wellness Initiative face-to-face experiential consists of. Yes, so in the video, you will see that the participants were actually wearing the colored face shield with some decorations. Yeah, so this is intended because we want the participants to see things in a different lens, and also the space is intentionally designed to create a different atmosphere. Next. Yeah, so over here you will see a photo collage of the participants' reflection of slips with the images that they have submitted. And next. Here are some of the common themes we gathered. So, for example, nature, phone, time management, comfort items, work-related items, and some participants actually recognize that using phone is a way of relaxation after a long day of work. However, other participants shared that it actually caused them to have revenge bedtime procrastination. And also one of the participants reflected that during the pandemic, it actually pushes her to redefine her way of rest. So instead of traveling out, she has learned to appreciate the nature in Singapore, and exercising in the nature has helped her to unwind from work and improve her quality of sleep. And work-related items actually illustrates the deadline and uncompleted work that prevents one to have sufficient quality rest. Next. So from this wellness initiative, we gathered that SWPs are aware of what contributes to a conducive sleep environment for themselves, and they are aware of what they need to do to have more quality or quantity sleep. However, psychological and emotional impacts from situational factors keep them at night or unable to sleep. Next, yeah. So if sleep and work is 50-50, the reality is that our sleep is compromised with our preoccupation about work, such as anxiety from work, crises, clients, and deadlines. So this may result to less work-life balance and increased risk of burnout. Next. So another insight that we have is that there are actually several barriers to a workers' help-seeking behavior, which includes awareness of resources and workers' own apprehension towards seeking help. Next, workers may not even be aware of the resources to support them, and this may be due to the lack of education or communication between organization and the staff. Next, on the other hand, in many cases, workers may be aware of the resources available to seek help, but we have found three main areas that contribute to a worker's apprehension or reluctance towards seeking help. Firstly, it is the individual's perception and self-evaluation of their own skills, competency, and capacity to handle stress. Workers may have a preconceived notions of how they should have the skills and competency to manage their work demands and own stress, especially as a helping professional. Workers may also feel the need to tough it up in order to consider themselves as competent social workers, and thus may be unaware of their own personal stress threshold. Therefore, these workers may have the perception that they are able to or have to cope, despite feelings of exhaustion and burnout. Secondly, it is the workers' concern about their agency's perception of them. Workers may be concerned about their professional image from others like peers, supervisors, or managers, whereby seeking help may result to being labeled as give up easily or having low emotional capacity to handle stresses. Concerns of being reflected in appraisal also deters workers from seeking help. Thirdly, it is in the context of workers' experience within the agency. This could refer to the visibility of seeking help, such as having open conversations about coping, seeking help, and seeing experiences of colleagues tapping on resources available like Employment Assistance Program, EAP. These shared experiences can actually normalize and empower one to take steps to increase their mental well-being, which could in turn reduce their apprehension towards seeking help. Next, so our proposed recommendation is for organizations to shift from a remedial to developmental or preventive approaches. This may include having more flexible working arrangements, such as having hybrid arrangements, coming in later or work from home after handling crisis case the previous days, more flexibility in taking time off, and dedicated admin days. open conversations on using EAP as a normalized developmental or preventive measure rather than a prescriptive measure when workers feel close to burnout, with reassurance that there will be no consequences on the workers' evaluation, may actually enable staff to be more receptive to seek help. These above suggestions are collated from the wellness initiative provided by the staff on the ground when sharing on what could be helpful for them in regards to rest. Next. So having shared about the work done by Mission Tilam of working with families, research done, and the recent wellness initiative, there are various tools and resources that have been created and designed for the various age group and group size. So some of the tools and resources include session plans or materials to be used during the interventions with family or assessment framework related to sleep conversation. In consolidating the materials, a website has been created with the past work done and our resources. We will be actually sharing the link to access our webpage after this webinar so that those who are interested may take a look at it at your own free time. So for now, allow me to give you a sneak peek and share some of the tools. Yeah, so this is the web page that we have, and we actually listed down the projects that we have, our past work, which is the presentations, the wellness initiative, and also the recent research article. And we also have a page for the tools consolidated. So maybe I can share one or two tools with you all right now. So the first one is Sleepy Ring, which is actually a guide to family conversation on sleep, and it provides a simple guiding questions to form assessment on the family and their possible meaning making. So for example, questions like sleep on what, sleep with what, may actually allow the workers to form an assessment lens of the availability of resources and also the possible meaning making of needs versus wants. So there are also other questions on which the assessment lens of allocation of resources, family rules, consistency of family rules. And next, another resource is actually the Baby Bee book, which is designed and created by our ex-interns. And this book is actually used as an engagement tool in introducing bedtime routine during the family intervention. So the design of the book is actually intentional to facilitate conversations with the children, and also the using of puppet play to keep them engaged. So now maybe I'll stop share first. Okay, just give me a moment. So I actually have the actual book with me right now. Yes, and we actually have a Baby Bee puppet, yeah, but I don't know where is it, so that's why I use a substitute one. Yes, and actually in this book, there is actually holes so that we actually can have some puppet play, and it can be reflected here. So it's supposed to be a smaller one, and then you can just put it here. Yes, so I'll be passing my time back to Huzaifa to do the conclusion for this presentation.
Thanks, Cindy. Yeah. Okay, as our team wraps up the conversation or the sharing for today, I'll give the audience 20 seconds to just take a look at this sketch by one of our previous interns, Timothy, and just take a look at his sketch on what sleep means to him. Okay, yeah. So I think two key themes that we can derive from this picture. Firstly, is about the common humanity experience of sleep, in that whether you sleep on a thick 8-inch mattress, whether you sleep on the cold hard floor, whether you sleep in unsanitary conditions, or whether you sleep on the couch, we all need to sleep. And sleep is a basic physiological need. And some of us are just more privileged than others, in that some might be sleeping with the use of music or electronic devices. But either way, wherever we are, whether we're in Singapore or all over the world, we all basically need to sleep. And I think sleep as a common human experience is something that we want to talk about, because it has been relegated into the private sphere, or rather the personal spaces, which we don't talk about enough. Yeah. I think the other theme that we want to bring out from this picture is also a very important question that our CEO always asks us in our orientation sessions. What separates us, social workers or social work practitioners, from our clients or beneficiaries that we work with? Yeah. So one more time, the question: what separates us, or what is different between us, social workers, and how and our beneficiaries, or the individuals that we work with in the community or wherever it is? Yeah. And the answer that he shares, which is really important for us to take note, is fortune or luck. Yeah, it's even a fortune or luck that we are even born in Singapore. Yeah, as compared to if we were born elsewhere around the world. We can't actually choose our parents or who are we born to, the color of our skin, or even things that, or even characteristics that we are born with, like for example, our health. And I think it's also to remind ourselves to be kind to one another in understanding the diversity of experiences around our sleep and rest. From Mission Tilam, as we were doing our wellness initiative, this was our pitch to our fellow colleagues, that we don't talk enough about how the intensive work that we do affect our rest, affect our health, and also affect our general well-being. And this is not just for social work practitioners in the community. Whether you are medical social workers, whether you work in rehabilitative settings, whether you're a child protection officer, and doing important work for the community at large, we together as a collective should also be raising greater awareness in talking about how can we reposition rest and sleep as something crucial and important, alongside also talking about the quality and accountability of our work, of the work that we do. Yeah, I'm going to share a short article here from the International Federation of Social Work, Secretary General Dr. Rory Truell. Yeah, this research is fresh out of the oven, published on the 3rd of November. I wonder if you can see here what it says. It talks about how social work as a profession is absolutely essential as a service in all countries around the world, and are crucial to building functional societies and economies, as well as responding to national or global emergencies. Yet, they are expected to work in some of the most difficult working environments and frequently lack effective understanding and support from employing bodies. This is where the article really catches me. This is an exploitation of the goodwill of committed social workers and a failure of support for families and communities, especially when it comes to the work or the crucial work that we are doing. I think as we were going through preparing this presentation, I think this article really stands out, because the onus is then on all of us practitioners to also shift our focus and talk about rest, and talk about how and what do we need, because if we cannot share what we need, employing bodies also would not have a good understanding of how can they better support us. So I'll be ending today's presentation and looking forward to the Q&A, but it's really to look at how we can how we can shift from looking at things as a self or just for our own personal coping or personal rest, to look at it from how it can be done together as an agency or across the social service sector, in hopes that perhaps other sectors can turn to us to also look at how can we balance work accountability and on the other hand manage and ensure that our workers and practitioners have sufficient rest to last the marathon that we are kind of in. Thank you so much. Yeah, and hope that the presentation has been helpful for you all.
Thank you so much, Huzaifah, Cindy, and Chun, for sharing about Mission Tilam as well as your own reflections. So at this point, I just want to highlight that I will be sending a follow-up email that contains the links and resources to Mission Tilam's website. So for audience who have been asking for resources. And right now, I'll pass the time over to Dr. Caris Chan to moderate the Q&A. So later, when the discussion is open to the floor, I will allow audience to unmute and turn on camera if you prefer to ask your questions directly. Yeah, thank you.
Thanks, Zhihan. And firstly, thanks, Huzaifah, for sharing your home visit experience, and to Chunging and Cindy for sharing more about your research project. So we have had quite a number of questions through Pigeonhole, and I thought I might group some of them and ask you guys in batches. I think the very first group of questions that we had was actually about your home visit, Huzaifah. We have about 3 questions about that. The first couple of questions are about, when you did your home visit, did you subsequently share with your client how they could improve their hygiene, and how did you go about approaching the issue? And there are 2 other related questions to that. How did your home visit experience change your attitude towards sleep? And also, how have your home visit, just a third one about, how do you sort of like manage the, when you visit your clients, how do you want to not come across as being disrespectful towards them? Do you want to answer those questions, Huzaifah?
I think I will start with those. Yeah. So for that particular case, we did work alongside with the grassroots and also SSO to kind of get additional resources to address the bed bugs issue. Yeah. So I think it's also one to realize, it was quite difficult at first to realize also that the family has been doing the best. They have been keeping their house clean, but it's also because of how the built infrastructure is, in terms of how the rental flat housing's architecture is, and perhaps the source of the bed bugs could be even not within their floor, it could be from the floors above, but because of how they are so closely packed, it could even be like a block issue rather than just a household issue. So we had conversations with the grassroots, and we managed to secure several fumigation sessions. At the same time, also getting resources to purchase furnitures to kind of furnish the home and allow the children to have a better living environment. I think the challenge for this case, one is the access to additional resources, but the other is then which is linked to the other question. How do we take a stance whereby we are talking about the problem but not blaming them for their predicament? Yeah, so we talk about the problem because it is a problem that they have to overcome, but how do we position ourselves such that it doesn't come across that they are completely to be blamed? Because they have been trying their best. They tell us all the different things that they have done. They even tried spraying insecticide on their mattresses, which I think left a very unpleasant smell, and decided not to do that again. Yeah, because it's really also in desperation with limited resources. What can you do to improve your living situation? Yeah, and wait, let me see. What was the other question, Caris?
So how have your home visit experiences such as this changed your attitudes towards sleep and rest?
Yeah, okay. So attitudes towards sleep, I think it's really one that it makes us realize that our work is almost as if when we work with our families or work with our beneficiaries, it is more interconnected than we think. Yeah. Our experiences as perhaps more privileged individuals, with social workers with a minimum degree as an entry point to enter the profession or field, is privileges that make me think about, or I think about more about my privileges as I'm working with families, and also to have better empathy towards what they have been trying to do, and also to give credit for them that they have tried all they can, to the point that they just decide to have to live with it. Yeah, I think not just when it comes to the experiences working with families about their sleep, I think it's also then tuning more into the children's experience of sleep. Because even young children can talk about sleep, and I think this was something that we curated a bit more together with Cindy in terms of how do we engage young children about talking about sleep, and how can we empower them to also take control about deciding when they want to sleep, or also following structure within the home to enable them to sleep. Maybe I can pass to Cindy to give a bit more insight on her work with children.
Yeah, thank you, Huzaifah. Yeah, so I think as what Huzaifah mentioned in terms of how we can empower children in terms of their sleep, I think firstly is creating a structure. Like sometimes in terms of children in the disadvantaged families, they may lack of the structures and routines at home. Yeah, so I think one of the things that Mission Tilam aims to implement is really a bedtime routine. Yeah, but I think within that routine, we also want to create some flexibility for the children in terms of taking one step at a time in terms of adjusting their sleep timing also. Because I mean, some children may be sleeping at 12 p.m. midnight, and it would not be possible if we just push them to sleep at 9 p.m. Yeah, so it's really going pacing with them also, like starting from where they are. Yes, yeah. And I think another activity that we actually do with the children to find out more about their sleep arrangement is getting them to draw out where is their bed, who sleeps where, what materials and what resources they have. Yeah, to really get a better understanding from them. Yes, yeah. All right.
Yeah, thank you. Well, I really like how you guys have sort of targeted the young as well, because sleep hygiene and sleep quality is not just an issue for low SES people. In fact, a lot of the population, even high SES and privileged people, do actually have pretty poor sleep hygiene. But obviously, they face a different set of issues. It's not to do with, the lack of resources, but perhaps a lot more resources that is distracting them and leading them to ruminate. So rumination is like, thinking about what happened in the day. It actually tends to keep people up at night. Anyway, we have to move on because we have a lot of questions. The next set of questions that I see that is being asked a lot is to do with the systemic barriers that people face, and how practitioners, researchers, and the government can work together to advocate for better quality sleep hygiene among low SES people. And I thought if any of you, Huzaifah, Cindy, and Chung Ying, might have any insights on this as to some of the better, more successful interventions you have come across with your project, with your research project as well.
Okay, yeah. Yeah, I can try to answer the question. Yeah. So when it comes to the systems work, I think on our end, we are starting with the closest systems with us, working with us, who are already working with us. So we do intentionally also work with the schools to explain a bit more the home context and how teachers and the counselors telling the kids, oh, just sleep earlier, it's a far cry from whether or not they want to, but they can't because of the situation in the household and the scarcity of space in which the family live in. Yeah, I think as we're having more conversations also, there are perhaps some shifts that as a practitioner I see in terms of HDB also piloting some schemes to see whether or not larger rental housing units are ideal or is something that would be helpful for families who are overcrowded or families with more number of children living in rental flat housing. So there are some pilots that I'm aware of, but I guess systemic shifts would take a longer period of time. But I think from a practice lens, we definitely can talk more about how the relationship between families and space, and perhaps how the space in which they live in directly affects how they rest and also affecting their waking hours. Yeah, maybe can give Chung Ying also to share a bit more about her experiences working with families and some of the small project advocacy, or I would say things that she has done with her clients as well.
Thanks, Huzaifah. Yeah, so I think in our research, right, and also with our work with our clients, I realized that as practitioners, we tend to frame clients' sleep or their issues very much as an individual problem. Now we tend to frame it as, or perhaps if let's say we improve their hygiene, or if we improve their sleep, a very targeted remedial kind of intervention, it doesn't always solve the problem, because a lot of times it's the structural issues. A 1-room rental flat, a 2-room rental flat, the space is so limited. Imagine ourselves living our living room, our sleeping area, all in the same space is simply not possible. So I think with regards to this, like what Huzaifah has mentioned, it is really very difficult to implement any structural interventions per se. But I think what we're trying to get across is how can we shift the mindset and perceptions of practitioners. How can we view the problem as a bigger picture? How can we see that our clients are already doing their best, to the best that they can? They're already trying out so many strategies, and are we giving them the opportunity to see how much that they are trying? Yeah, so I think yeah, well, that's one part. We're definitely not experts here trying to diagnose or trying to give a medicine on how to resolve the issue all in all, but it's more of how we can change our own mindsets as well.
Okay. The next sort of set of questions are to do with flexible working arrangements. I think this is to do with Huzaifah's later presentation, the second half, where you mentioned about giving social work practitioners more flexible working opportunities. So I think there are 2 questions about that. How can organizations support social workers with a better implementation of flexible working arrangements? And any examples that you guys have come across? I think the second question, just hold on, I'm just looking at the second question on this as well. I wonder if it's the same, just hold on. How can we encourage SSAs to adopt such flexible working arrangement practices?
Okay, I can try and answer. Then Cindy can also chime in, okay, because she presented that bit of the presentation. Okay, so when it comes to organizational matters, I think all 3 of us here, we are not in management per se. Yeah, but the data that we got are really sentiments from the ground in terms of their daily pinpoints, the stresses they face, and some of the areas where they felt they can be better supported, so they can be more effective workers, not just in the short term, but also in the long run. Yeah. So I think it's definitely one that has to be treaded carefully in terms of balancing. I think when it comes to work policies, as much as we would want to accede or follow or give in to the request of what workers or our staff wants, we also have to balance it in terms of the larger organizational strategies and also the what is necessary to produce good accountable work. Yeah. So I feel at this juncture, we can't answer directly this question, but I think it goes back to what are the principles or the values the organization hopes to communicate to the staff by the initiatives that they do, whether it's a top-down initiative or it's bottom-up initiatives that they're doing in their respective organizations. Yeah, I think in our own organizations, the fact that we have carved out a space for people of different seniority to come together to talk about REST is already one that is a first step into talking about the pain points and the rest of workers. And it's quite interesting. The lead-on conversation was about sleep and their relationship with sleep, but the thing that came after was about help seeking and being overworked and being overwhelmed by the crisis and the work-related demands. So it's almost that it's two sides of the same coin. And instead of asking directly about what are the stresses, what can we help you, perhaps looking at the other side of the coin in terms of how you can help workers rest, how workers rest at junctures whereby they are struggling, such that you don't have to address a burnout issue. We have lost colleagues to burnout and colleagues not being able to take the stress. How can we implement measures, preventive or developmental, earlier beforehand, such that we catch them and we allow them to feel that they are taken care of and we care about them. Yeah, I think that's what I'm trying to do as a supervisor, as a senior worker in the agency as well. Maybe you can share with Cindy if there's anything I missed out based on the ground responses.
I think Huzaifah summarizes it very well in terms of the responses from the ground. Yeah, so I think it's really I mean, as what Huzaifah mentioned, like we are not in the position to really see how you all can actually go to your manager and then say, hey, we also want flexible working arrangement. Yeah, but I think it's really if there's if you see that in your organization there's this ground sensing that it may actually benefit, and I think some can also hear the voices and see whether in terms of the management items, what is their perspective also. So I think also can also hear from Carrie if you have any inputs on this. Yeah,
sure. Sorry, I thought I was on mute. Basically in Australia, I mean, I do a lot of research with social workers. Basically, I collect data from them through interviews and quantitative surveys. On a side note, I just wanted to say that I found that your research methods were really innovative. And so maybe I might just have a question for you after as to how you actually develop this research method. But for us, we still stick to a lot of traditional methods, so surveying and longitudinal surveys and interviews. So in the Australian setting, actually, access to sleep clinics is very accessible to the whole population, and this is actually covered by Medicare. So if anyone high SES, low SES, middle class, if they had sleeping issues, they actually could just go to a sleep clinic, and orders are actually complimentary if you're under the government system. And so what the sleep clinic does is that they diagnose some of your sleep issues. They share with you some of the good habits for sleeping. But obviously, when you see the statistics of people who access sleep clinics, obviously the privileged people or people who have the time, they would naturally go and access sleep clinics. But those people who are busy working and they have to feed their whole family and they hold multiple jobs, obviously they tend to also access these services a lot lower than the general population. So even if you provided these resources for free, this is just showing you that it's not always accessible and it's not reaching out to the people most in need. So this is what Australia faces. But on a side note, in terms of the sort of like governmental agency, the more structural sort of support to social workers in Australia, I think I did share with Huzaifah in one of our earlier meetings that over the course of, I think the whole 2 decades, Australian social work as a whole profession, they have actually reduced their caseload. And so I'm actually across this because my own sister is a social worker in Singapore, and I know her caseload number. In Australia, it's actually kept to a maximum of if it's really desperate, it's about 15 cases per social worker. But on average, they only deal with about 10 to 12 clients. So I don't know about the real figure in Singapore. Maybe you guys can share with me. But in Australia, they've actually kept the caseload to a more manageable level, although obviously it's still quite unmanageable for some social workers. And so this is all interventions from the profession, the government, the ministry, and basically the union. The Australian unions are quite strong here. The union fighting for a more manageable workload for all of them. And so in terms of flexible working arrangements as well, you'll find that when you have a more manageable caseload, obviously it's a lot easier to implement them because they have their own agency to manage their own caseload. Obviously, the higher the number of caseload, you'll find that it's very hard to, implement flexible working arrangements or, to implement that sort of like flexibility in your choice of working, because people are actually all burnt out, even at the management level. So you find that when caseloads are sort of reduced, it becomes a lot more easier to implement a holistic well-being approach for social workers. But obviously, it doesn't apply to all. If you see some statistics, I think in Perth, it's actually quite well protected. But if you go to New South Wales and Victoria, a lot of them are still struggling with the caseload because it's still quite high. Sorry, actually, I took a lot of your answering time. We might actually jump back to the questions because we have a lot more coming. So I just wanted to, there's a new question that came in as well. It's not easy to get 50% work and 50% sleep due to family or burnout. So how would you, just hold on, I think I saw that question. And how can good practices achieve that?
Okay, yeah. I think just to share, the 50-50 was just an arbitrary number. Yeah, we use a 50-50 as an ideal, and it's really not easy. I think I can speak on behalf of many social workers that I would think that the work is really quite overwhelming. Yeah, I think especially when it comes to crisis cases or crises that require immediate attention to, it can really be exhausting. And after the crisis case, there's still the follow-up for us to follow through. Yeah. If I were to try to answer this question, perhaps then instead of looking again at it as an individual and what we can do, it's really then a team-based approach. Yeah, a team-based approach can be something that we look at in terms of how do we come in as supervisors or even come in as senior practitioners to help and hold the hands of our younger junior workers to ensure that they are managing and in a way discerning a bit more when some of the younger junior workers also say that, oh, they don't need help, they're fine. Yeah, and again, that is part of the apprehension that we identified as part of the wellness initiative, that workers also have pride. They also have their very strong conviction in terms of them being a competent worker. They can do it. But I think that's on the other hand, how do we encourage social workers to also talk about their vulnerabilities, and how perhaps from a team approach, more senior workers can share also about some of their struggles and turn some of these vulnerabilities into conversations of strengths. Because then if we put on an armor and we just distract ourselves or we just avoid our own hurt, it's very likely that the counter-transference and the transference will take place within our cases. Yeah, and us not asking for help is also incongruent in how we hope our clients themselves seek help and contact us when they're in need or perhaps needing additional support. So I guess from a team-based approach, then at least there's some things that we can do, and having practices within the team that enables staff to look out for one another. One day, someone else might be having a bad day. Another day, it might be you. And how can we work together and have clients as a priority in terms of the beneficiaries we serve, rather than getting into tensions within the team saying that, oh, I never do my work, then someone have to pick up my slack. And I think it's really that supportive environment that can enable a better percentage between work and rest. Yeah, but I mean, we are also up against structures that causes our casework count to be of a certain amount. We are also constrained by policies in play that also expects us to ensure that we meet certain KPIs every month. So I guess it's a lot of factors that we can consider, but as a team, how do we take care of each other, and what strategies might work with one team might be different for another because of the makeup or the personalities within the team as well. Yeah, but I guess the team-based approach is what I feel that can be quite possible for us to start with.
Thanks, Huzaifah. I think we have time for just one more question, and the other questions, I think we'll compile them. I'm pretty sure Zhihan will compile them and circulate to your team. I think we just had one last question, and this is also ties in with my question. I found that your research method for your Mission Tilam, your project Tilam, very innovative. So can you share how you sort of developed that? And relatedly, one question actually asked to clarify, what are the different stations in the dark room? I think earlier on in your presentation, you flashed the dark room and then you had different stations. I think one participant is asking about more clarification about what the stations are.
Maybe I can take that question in terms of what each stations and perhaps what the participants actually do. Yeah, so actually in terms of, maybe I can share screen. Maybe I just share briefly, right? So when they go into this space, yeah, we actually had they actually do wear the face shield, and the environment is dark lah. So we actually wanted them to have a self-reflections of the images that they have submitted. Then afterwards, we also have small groups in threes where they'll share about each other's experiences of sleep. And then I think subsequently we also have a discussion on sleep and rest. Yeah. And I think before that, we also have hearing a video clip of the client's narration of their experiences with sleep. And let me see. Yes. So in a way, there's a individual, small group, and a big group discussions on that.
Yeah. So you can know more about the different stations on the website. I think the link will be given. Yeah, I think just one last thing. I think shout out to NUS SSR as well. In terms of the research methodologies, I was blessed to be working with Dr. Neo Yu Wei as part of the SSR research mentorship. And with that additional academic support, it also made me a bit more courageous to experiment with more creative methodologies. And I found that using photo voice, which is a technique under the arts-based ethnographic engagement method, yeah, I think it's really helpful because it gives power back to the families to decide what they want to share and the starting point that they wish to share about their relationship with sleep. So instead of us coming in and just bombarding them with questions and understanding their rest, I found that the photo voice method really gave a touch of how clients can share their lived expert experiences, at the same time also framing what they wish to talk about. Yeah, and it's quite empowering also because then we elicit a lot more of the considerations of what clients have been doing or keeping up to do in order to ensure that the environment is towards their preference. And I think what was an additional methodological difference was that the research was done during the COVID period. So it was done over Zoom. And the interesting part is that initially we thought that it would be difficult to communicate, but even doing the interview over Zoom in their household became more of like clients showing us like a house tour. So they bring their cameras around the house, and it's also giving them power in terms of sharing what they wish to share and not disclosing or making it invisible what they don't wish to share. And I guess that is also a reflection in terms of how it's respectful practice in terms of engaging populations who are more vulnerable or perhaps more disenfranchised than our usual types of interviewees or respondents. Yeah, so thank you also to SSR for giving the opportunity to run the research, and also our organization for helping, allowing me to attend the research mentorship.
So I'll pass the floor back to Zhihan. Thank you, Huzaifa, Cindy, and Chung Ying for sharing your very interesting research again, and obviously to Huzaifa for sharing his home visit experience. Zhihan, please.
Yeah, okay. Thank you, Dr. Chan, for moderating this session. I'll quickly launch the feedback poll. Yeah, please take some time to give us your feedback for this webinar. And before I end off, I'll just quickly share our next webinar. Yeah, so we will have one more webinar next month in December by the National Council of Social Service, who will be sharing their results of their social service sector survey last year. And just to share also that in our next subsequent webinar in January, NCSS will also be sharing their quality of life study on children and youth in Singapore. So hope that the audience can join us again for our upcoming webinars. And if you would like to receive regular updates, please join our mailing list using the QR code on the screen over here. Yeah, so that's all I have for today. We've overrun a bit. So thank you so much, everyone, for joining us today. And yeah, I hope you learned something new from this webinar sharing. Yeah, thank you so much to Huzaifa, Cindy, Chung Ying, and Dr. Chan, yeah, for your time. Okay. Huzaifa, you wanted to take a screenshot photo or no? Okay. Yeah. Otherwise, yeah, we have come to the end of the webinar. Yeah, please feel free to leave the session. Yeah, thank you.